All right, so good morning, everybody. Thank you so much for tuning into this webinar. My name is Sarah Devitt, and I work with the Montana Rural Health Initiative. The mission of the RHI is to engage partners to share ideas and expertise and to support communities in involving health while stimulating a higher level of wellness across the state. Thank you again for joining us today. The webinar is titled National Health Service Corps in Montana, presented by Julie Fife. Julie Fife is the Montana Primary Care Office Director. The Primary Care Office coordinates data collection and analysis of health professional shortage area designations and workforce planning, provides technical assistance for the National Health Service Corps programs, conducts site visits for the National Health Service Corps programs, and administers the J-1 visa waiver program. Just a few little technical details before we get started. So I have muted all of you, and if you would like to unmute yourself, you will have to press *6. Maybe if you want to ask a question over the line, this is when you would unmute yourself. But you can also submit questions to me via the little chat box, and I will happily read them and ask them to Julie. I think at the end is when we would prefer to have questions, but Julie can decide when she's presenting. All right, so thank you again, and Julie, I'm going to hand it over to you.
Great. Can you hear me?
I can. Yep. Thank you.
Okay, great. Well, thanks, Sarah, for getting us all set up here. Just going to get my slides up there for you to see. Can you see them okay?
Yep, looks good.
Okay, great. Well, yeah, like Sarah said, my name is Julie Fife, and I am the Montana Primary Care Office Director. And we're just really excited to work with the AHECs in promoting the National Health Service Corps and getting more information out there about how it works to Montana. I apologize, first of all, for my voice. I lost my voice this weekend. So hopefully you'll all be able to hear me. And I will pause occasionally for questions to give you opportunities to ask throughout the presentation. So feel free to type the questions into the chat box for Sarah, or you can ask them when I pause. So we at the main focus of the primary care office is to collect data, workforce data, and to evaluate the health professional shortage area designations. HPSAs are federal designations that are intended to indicate areas of workforce needs. HPSA designations can be either geographic. In Montana, usually for the geographic ones, they're usually county-based, so the entire county will have a HPSA designation. There are instances, though, that the entire county isn't, and there's just partial area that is a designation. One example of that for Lewis and Clark County would be the Lincoln service area. They could also be connected to a specific population group or a healthcare facility. And then there are 3 different types. They can be a primary care HPSA, a dental HPSA, or a mental health HPSA. So the designations are made, but then after they're made, they're also scored. And I just gave on the screen here some of the determining factors of HPSA scores. There's the population to provider ratios, the percent below poverty, the travel time to the nearest non-designated providers, the infant mortality and low birth weight, and then for the dental, access to fluoridated water, and then for the mental health, there's a couple different ones, use in elderly population, and then also the substance and alcohol abuse. So anyway, so all of these factors are combined, and then they are scored. And in Montana, here's kind of a map that is broken out by scoring. But the scoring comes into play when they start prioritizing who's going to get awarded the funding. And how it is funded is that they start from the highest HPSA scores and fund down. The highest scores reflect the highest need. So you can kind of see in Montana where those different scores are. We'll talk more about that in a second. So yeah, so why are they important? So federal and state programs use the HPSA designations to determine eligibility and then also to prioritize. And like I just said, National Health Service Corps funds from highest down. It says awardees working in sites with HPSA scores of 14 and higher receive higher funding. That's based on the federal program versus the state program. The federal program funds those ones at the higher level. They start at the 20. Well, it's 25 for primary care. 26 is for dental. Mental health, I believe that's 25 as well. But and I believe last year they only were able to fund down through some of the 15, not even into the 14s that I'm aware of. But maybe if Brenda's on the call, she's our project officer, she can let us know if I'm 100% accurate on that. But what happens when they start running out of funding, and there are two providers with equal HPSA scores, is then they start going by the date of application. And so that's kind of how they're prioritized at the federal level. And then the state student loan repayment program, it picks up at where the federal program leaves off, and it funds from the highest of the second tier, I guess. So it would start from 14 and on down. And we do it the same way. We start with the highest, and then when we start running out of funding, then we also go by the date of application. The HPSA scores are also used to guide placement opportunities. So the scholars have a limited number of placement opportunities, and they are directed to the areas of the greatest need. So probably those 14, definitely those 14 and higher. And then our J-1 visa waiver program, those participants are also required to work in HPSA designated areas. HPSAs also go to other federal and state programs, or are also used by other federal and state programs for help center grants and other things. But the things that we work with out of the primary care office are primarily these loan repayment programs. So I'll pause right there for any questions, if you guys have any questions about the HPSAs.
And remember,
And I think to unmute is press star 6. Is that right, Sarah?
you got it, Julie. That's exactly what I was about to say, so thank you.
Okay. Are there any in the chat box?
I'm not seeing any.
Okay, so I'll just keep going. So the programs that the Bureau of Health Workforce have, there's several different loan repayment and scholarship programs that they work with. The ones that we work with here at the state primary care office are mostly these that we provide technical assistance for. The scholarship program, the national, the federal level loan repayment program, and then the state loan repayment program. I'll back up there. There's also a nurse scholarship program, and we get a lot of calls about this, but unfortunately we don't have a whole lot of information. We kind of direct them to online resources, and we can answer information or questions about what HPSAs are in the area, are in specific areas around Montana. But other than that, we don't have a whole lot of information or connection to that program. So the first one is the scholarship program, and what that is that it provides students that are pursuing primary care careers the opportunity to receive scholarships. So they get help with tuition and fees and books and things like that, and they also receive a monthly stipend for that. And what it is that it's for every year of support that they receive, they are obligated for a year of service, and it's a 1-to-1. 1 year of service equals 1 year, or 1 year of support rather equals 1 year of service, with a minimum of a 2-year commitment. So with that scholarship program, we At the primary care office, our technical assistance that we provide for that program is also pretty limited. When people call about information about the scholarship program, I can kind of, when sites call in particular, wanting to know how they get a scholar, I can kind of tell them what the process is, and that National Health Service Corps scholars will identify Montana as an area where they want to work, and then NHSC contacts Brenda, who is our regional National Health Service Corps project officer, and she kind of assists in helping the placement of those. And what she told me is that she looks on the website. The National Health Service Corps Job Center website is really important for her to help her identify where scholars could go and where our open positions are. I also let them know that if they would like to let Brenda know that they are looking for a scholar, that it's good to give her a heads up, but also really stress the importance of keeping their NHSC portal and position announcements really current on that website, because that's how the connection is made, and that's how scholars can look around. The other thing that I answer is sometimes sites are interested in figuring out how many scholars can be per site, and there can be only one scholar per site per year, and that's different from the loan repayment program, where there can be an unlimited number of loan repayers there. And then I can also provide information just about the HIPs, as what the score and the different areas are. So those are the three things I primarily answer about the scholarship program. But again, I'll pause real quick and see if there are any questions about the scholarship program. And to unmute your line, it is *6.
All right, so we have a comment, Julie.
Okay.
The comment reads, there are 5 urban Indian health programs in Montana, and they all have HIPSA scores. For example, the Helena Indian Alliance has a HIPSA score of 19. Our service area is Lewis and Clark, Jefferson, and Broadwater counties.
Great.
All right.
Yes, that's a great example of a facility and population, specific population HIPSA. And those are great. Those are high. I don't know if they're great scores. I mean, maybe I shouldn't say great, because they indicate a high level of need, but they are good because they're so high. It puts scholars or loan repayers in a good position to receive loan repayment or the scholarship money, or I guess the service obligation to pay back the scholarship. So thanks. Any other questions or comments? Okay, we'll go on to the loan repayment programs. And these programs are ones that we provide the most technical assistance for here at the primary care office. There are two programs. There's the federal program, which is up to $50,000 with a 2-year minimum. And then there's the state student loan repayment, the state student loan repayment program, which is up to $30,000 for a 2-year commitment. And then something that a lot of people aren't aware of is that that providers can do more than just the 2 years. They're not caught off at 2 years, but they can keep doing it as long as they have eligible student loans. So really, it's possible for them, if they commit to those areas long enough, to pay off all of their student loans, which is great. The state student loan repayment program provides cost-sharing grants to states. So there are 30 states that receive these grants, and they require a 1-to-1 match. And so at the state level, we've been given some of the match money, but then we've also looked to facilities to also supply some of that match money. And then there's a little bit more flexibility within the state program. We can include, it says, they have the option to expand eligible disciplines. So the federal program doesn't include RNs or pharmacists, and at the state, we do include them. So actually, the federal program does include critical access hospitals as well, but so does the state. Yeah, okay. So I'm just going to keep moving on because we're going to talk about this stuff in just a minute. So I want to give you a little bit of an idea of what currently what currently National Health Service Corps looks like in Montana. And right now, there are about 189 National Health Service Corps providers between the two loan repayment programs and the scholarship program. And then there's kind of a breakdown there of the number of physicians, the number of nurse practitioners, physician assistants. We've got one midwife through the state student loan repayment program, the number of dentists, dental hygienists, behavioral health, and then RNs and pharmacists. And this was the numbers as of September. Now in the state student loan repayment program, we also have a pharmacist, which is kind of interesting. And then you can just kind of look there at the amount, the awards amount, the amount of money that those bring into the state of Montana. And then this next slide breaks it down. It was the same numbers, just put into percentages, so you can see that we have the highest percentage of mental health providers out there. So just a little bit more information. And then again, with the two, this is just a breakdown of the program splits. So most, like I was saying, we provide most technical assistance for the loan repayment program. Both of those. And then the scholarship program is pretty limited because, one scholar per site, per cycle. Okay, and this is just to give you a little bit of information about just between last year, or 2013 and 2014, the numbers, and across all disciplines, they've gone up. Particularly in the mental health, primary care has gone up quite a bit too. But the really interesting thing, I think we can look at the numbers, but I think that the geographic distribution is really an interesting thing to look at. One of the things that I always like to kind of point out is how interesting it is and how much of a help it is that we have from western Montana and how pretty it is there. When we surveyed National Health Service Corps members and asked them, what attracted you to Montana? Why did you choose to serve in Montana? They always say, of course, the beautiful outdoors. And then the second thing they talk about is the broad scope of practice. And then many of them let us know that they really feel like their community needs them and they feel supported and like the work that they do is really valued there. The other thing I thought that was really interesting when we surveyed them is that they also identified that there's no sales tax here, which was really great. So I thought that was kind of funny. So when we look at the application process for National Health Service Corps, there's kind of two things that are filtered. There's site eligibility and there's provider eligibility, and they're two separate things. They kind of blend together if the site and the provider are one and the same. If they're a private practice, then they kind of come together a little bit, but they're two different things. So the first thing I wanted to talk about is site eligibility. Here's just a slide of kind of the benefits of being a National Health Service Corps site. The biggest thing is that you're eligible for your providers at your site then become eligible for National Health Service Corps loan repayment, which is a huge recruitment opportunity for sites. And you're able to post those positions on the NHSC National or Job Corps. You're able to connect with other NHSC-approved sites, receive community and site development assistance, establish an integrated system of care that includes uninsured and underinsured, and develop linkages with academic institutions and other organizations. So also a little breakdown of the number of approved sites in Montana, and you can kind of see that they've consistently gone up. And we'd like to continue to get the word out to communities where there are sites that probably are already doing many of the things that make them eligible. They just need to know kind of the application process so that they can get those providers some loan repayment. But some of the eligibility requirements, this is just an abbreviated version of those. The site has to be located and treat patients in a HPSA designation. They cannot discriminate based on an individual's ability to pay, race, gender, age, or sexual orientation. They have to accept Medicare, Medicaid, Healthy Montana Kids. They have to post and honor a sliding fee scale, and that sliding fee scale has to be consistent with the current federal poverty guidelines. And then they must have been in operation for a minimum of 12 months prior to the site approval. So they must have been already taking Medicaid and Medicare and that sliding fee scale for a minimum of 12 months. And then that cycle opens March this year. It just opened, it opened March 31st, not March 30th, I apologize. March 31st through June 2nd this year. And the sites have to be approved before providers will be eligible for loan repayment. And their cycle, the provider's application cycle, opens in January and closes March 30th. So those cycles never overlap. And this is the cycle that needs to be taken care of first. Sites have to be approved first, and then the following January, providers can apply. So some other considerations for sites is that site approval does not guarantee loan repayment. There are other considerations that go into loan repayment, the number of direct patient care hours in the outpatient setting, whether or not the provider has eligible student loans, and then, of course, HPSA scores are also a consideration as well. So, so the sites also need to keep their point of contact information up to date, and they also need to recertify every 3 years. So once you're approved, it's not an approval for forever. It's a every 3 years thing. So that recertification opens in the fall between September and November. And how sites apply is they usually give me a call first, and we look at their HPSA scores. And even if HPSA scores are maybe not that 15 and above, I think it's always beneficial for sites to apply to be an approved site. For the state student loan repayment program, we want to see that sites are eligible. So they have to meet all the same criteria as the federal program. And also those HPSA scores, if there's a community that loses a bunch of providers, communities can contact the primary care office, and we can reevaluate and reapply for a new score. And so those scores are, if not perfect, are responsive at least a little bit to community needs. And so if there are a bunch of providers that are lost and we are able to rescore it, and there's a higher score, then if you're an already approved site, then your providers would then be ready in that January to March cycle and wouldn't have to wait, another year for the site to become eligible from the March to June cycle. So they call and we kind of talk about those kinds of things, and then they complete and submit their site application online. And I put a link to the portal here. We'll see if it can take me there real quick. But this is kind of what it looks like, and how people would go into it is a site would be considered a site point of contact, and you would create your account this way. And that's where you would access the application. Okay. So, and then here's some more information just about, there's a site manual that is detailed, and I just gave a brief overview of it, but it's way more detailed here. And I'll pause right now to see if there's any questions about that site eligibility. Sarah, are you able to hear me okay?
Yep, I can hear
Okay.
you. Perfect. Thanks.
Okay. So if there are no questions, then we'll go on to the provider eligibility part of the National Health Service Corps. The first thing is that the provider has to be practicing in one of the eligible disciplines. So it has to be a physician, a nurse practitioner, a certified nurse wife, a physician assistant. Let me make sure that I have it on another slide. And with those, it's primary care specific. For the state program, we also have the registered nurses, and we also have the pharmacists. And those are also, well, for pharmacists, it can be really any of the areas: primary care, mental health, or dental. But the thing to think about with all of these is that their direct patient care hours need to be in the outpatient setting. At least there's a minimum amount that have to be in the outpatient setting. So registered nurses, that can often be a difficult thing for. And I'll talk about some of the exceptions to that here in just a minute. For the dental providers, it's the dentist, either general or pediatric dentist, and then also the dental hygienist. And then for mental health, psychiatrists, psychologists, licensed clinical social workers, psychiatric nurse specialists, marriage and family therapists, and licensed professional counselors all qualify. And then their eligibility, they have to be a U.S. citizen, which is, we actually had a call about this not too long ago, wondering if the J-1 visa waiver students or providers just coming in that came out of schools and came out of a U.S. university and had these loans were eligible for the program, and unfortunately they're not. They have to be currently working or applying to work at an approved site. They have to have unpaid government or commercial loans for school tuition. And they have to be licensed to practice in the state where they're going to work. So they have to be licensed here in Montana. And then they have to provide direct patient care services in the outpatient setting. There's a minimum direct patient care in the care hours that are discipline specific. And they have special allowances for the number of hours that can be, they have a few, there's more hours that can be dedicated to teaching or to other types of services in the teaching health centers and the critical access hospitals. A provider can also work at multiple approved sites to meet their hour requirements. So they could potentially have a few different sites. Maybe they could work part-time at one site and then part-time at another, and they would still get the full-time loan repayment. And how they apply is that, again, I usually direct them to the National Health Service Corps website that has a manual that outlines all in detail all of the requirements for providers, the hour requirements, the site requirements and everything. A lot of them are wondering where approved sites are or if the current site that they're at is approved. And so I direct them to, we look at the HIPSA, and then we also look at the National Health Service Corps job site to see if they're already an approved site. And then a lot of times, if the site isn't, then it starts a discussion between the primary care office and then their site about how their sites can become approved. And then they go online, and the website there, it directs you right to how to apply. And then they can contact me, or if I don't know, a lot of times I'll direct them to Brenda for more information if they have trouble filling out their application. So then after this award is received, there's some things that maybe before they receive the award that should be thought about, some considerations. And for the sites, sites need to verify that the National Health Service Corps participants, their providers that are practicing or that are awarded, are fulfilling their service obligation, and then they notify National Health Service Corps of any changes. For the state program, they would notify the primary care office of those changes. They have to make sure that the providers have the opportunity to fulfill their service obligation. So they have to be mindful of those direct patient care hours and what providers are required, the minimum requirements for the outpatient setting. And then they also have to allow for site visits, which is where somebody from the state or the federal program will just come in and kind of just visit with you about how it's going, and maybe we'll request the sliding fee scale and things like that. And then the sites need to ensure that practice policies continue to align with the National Health Service Corps eligibility requirements. So they need to continue to accept Medicare and Medicaid and sliding fee scale and all those things that they said that they were going to do. And then the provider needs to be able to fulfill the service commitment of the approved site. And there are options for transferring, and that needs to happen through the National Health Service Corps. A provider has to, notify National Health Service Corps, or the state has to. The state student loan repayment program participants have to notify the primary care office, and then they receive approval prior to the transfer. The provider can change between full-time and part-time obligations. They can go from full-time to part-time or vice versa, part-time to full-time. Waivers and suspensions are offered in extreme situations. And like I said before, transfers to a different NHSC approved site are possible. I think the other thing that I would let providers know about transfers is that it's good to look for another site that you're transferring to with either an equal HIPSA score or a higher HIPSA score, so they're meeting the same amount of needs that they signed up for. And then also, they really need to consider the hefty default provision. If they sign up for it, it's really important that they're going to complete their service obligation, because the default is pretty big, and it's intended to keep people in service, so that it's not a half situation. So then the last thing is I just kind of wanted to show you how it all comes together in a community in Havre. So we first of all, we start off doing we gather all of the data, and we do the HIPSA designation. So there in Hill County, they have a low-income HIPSA designation. So with that, it made them eligible for a health center grant. So this was just a picture of the Bullhook Community Health Center. They were able to get that grant, and how I understand it is that the health center started out with the health department and was there, and then the grant that funded that was cut, and then they were eligible for this I think a 330 grant, which allowed them to be a freestanding entity, nonprofit. And so now, and they were also able to expand their services to include dental and mental health services. So at that health center right now, and I don't have it sitting in front of me, but they have, I believe they have 2 mental health providers receiving loan repayment, 1 family practice physician, and then they now have a pharmacist through the state program that are all receiving loan repayment there. They also have a rural health center there that has a couple of mental health providers receiving loan repayment, and they also have 4 mental health providers providing services in the school. And then finally, they also, because of the HPSA designation, were able to place a J1 visa waiver participant there, an oncologist is there. And that's just a breakdown of the numbers there. So now they have 7 mental health providers working there, 1 dentist, the dental hygienist as well at the CHC also received loan repayment. The physician, the pharmacist, and the oncologist. And then what's kind of neat is looking beyond that, and just at the Bullhook Community Health Center alone, not even looking at the schools or the rural health center, just the amount of money and the amount of work that they provide is really wonderful for that community. So let's kind of let you look at those numbers and open it up for questions if anybody has any questions.
Thank you so much, Julie. We do have a couple questions I'm seeing come up. Are the state loan repayment funding amounts the same as the federal amounts? Are part-time providers eligible?
Great. So the federal program funds providers up to $50,000 for a 2-year commitment. The state student loan repayment program only funds up to $30,000 for a 2-year commitment. This can be a little bit different if there's a facility that is going to provide the match funding for that, in which case it can be up to the $50,000 as well. And then yes, for both of them, for the federal one, a part-time option is available, and for the state one, the part-time option is available. However, at the state level, we do prioritize full-time first. So those individuals that are seeking full-time loan repayment, their applications will be prioritized over the part-time. But when a provider is, maybe they do commit to a full-time, there is the option for them to go to a part-time commitment if the circumstances change and then they need that.
Awesome, thank you. And we have another question. It's, can you share with us what the hours required?
Sure, I can. Well, it gets a little bit because it's so, because it is discipline specific, it kind of changes a little bit. But overall, for most, I'm just going to open up the manual here real quick. For most primary care, well, for most providers, it's a minimum for full-time of 40 hours a week, with 32 of those hours being needing to be in the direct patient care setting. And then 8 of those, no more than 8 of those, could be in administrative type work. Let me just double check. And then if they're at a teaching hospital, the teaching activities cannot exceed 20 hours a week, and the remaining 20 hours must be spent in clinical services for patients. If providers work at a critical access hospital, at least 16 of those hours must be spent providing direct patient care. The remaining 24 can be spent providing, doing other things. They could be working in the associated critical access hospital in the ER or at the skilled nursing facility or performing practice-related administrative activities. So those hours are limited to 8 hours as well. For OB/GYN, at least 21 hours must be spent providing direct patient care in the outpatient setting. The remaining 19 can be in other settings. Again, there's a few exceptions for critical access hospitals and teaching. For dental, a provider has to work 32 hours doing direct patient care, no more than 8. Could be spent doing teaching, providing clinical services in the alternative setting, or administrative activities. If they're working in a teaching health center, teaching activities cannot exceed 20 hours. For pediatric dentists, at least 20 hours a week are spent direct patient care. The remaining 19 are spent providing clinical services for patients or teaching at an approved site, providing clinical services in the alternative settings, such as hospitals, nursing homes, shelters, as directed by the approved site, or performing practice-related administrative activities, which are limited to 8 hours. And then for behavioral and mental health, at least 40 hours a week for a minimum of 45 weeks a year. At least 21 hours are spent providing direct patient care at the approved site. The remaining 19 are spent providing clinical services for patients or teaching at the approved site. And then there are a few, again, with critical access hospitals, at least 16 hours in direct patient care, 24 can be spent provided in alternative settings. So it varies quite a bit just based on discipline and if you're at a critical access hospital and those things.
Awesome. Thank you for answering those.
Sure. It gets kind of complicated. The other thing is those vary a little bit for part-time as well. I just gave you the full-time, but...
Right, and the guidelines are online, right, where they can see all
Yes. And so where you would find that the direct patient care hours would be in the NHSC. It's in the manual specific for the providers, which is they're all on the NHSC website, which I believe is on the slides.
Perfect.
So are there any other questions?
I'm not seeing any questions come in my way. Okay. And again, if you guys do want to ask a question, just unmute your line by pressing *6.
Well, okay. That's all I have to share. I apologize for my voice.
Oh my gosh, Julie, thank you so much for doing this with especially a sore throat in your voice. I hope that you get feeling better, and I know that you have answered a lot of our questions, so thank you so very much.
Great, and feel free to contact me after this if anybody has any questions as well.
Okay, perfect.
Thanks.
Thank you so much. Have a wonderful day.
You too. Bye-bye.
Bye.